Now I want to speak to you about carbon monoxide poisoning. This is a classic boards question and something that you really don't want to miss. So here you go. It'll present a couple of ways. Here's the typical way. It's the first cold day of the heating season somewhere in the country. They live somewhere north. And when it gets cold in the fall, people turn on their furnaces for the first time, and the furnace is faulty, and carbon monoxide builds up in the house. So you'll have a family that comes in on the first cold day of the fall, and they'll say they all have the flu, but it's not influenza season yet. Okay? They do have headache and nausea, maybe some vomiting, but there's no fever, there's no cough, there's no myalgia. And again, there's influenza. The virus has not yet been reported in the area. There's no outbreak of influenza yet. They might also say they seem sad because their pet died. You know, they might have had a dog that passed away during the night or a bird that passed away. They woke up with a dead pet in the house. If there's an older person in the house that has some pre-existing disease, cardiovascular disease, they might say that older person had a fainting spell or had angina or had a stroke or had chest pain. All the patients come in, their color is good, they're pink, and it's multiple family members. It's everyone in the house. Okay, that's carbon monoxide poisoning. The other way they'll present the case, one other way, is, well, there's a couple other ways. They might present carbon monoxide poisoning as part of a house fire. Anytime there's a burn case, think carbon monoxide poisoning. Get the CO, carbon monoxide level, to tell for sure. Another way they might do it is they might show you a case of a retired man, well, it doesn't have to be retired, but someone working in their basement in an unventilated area on furniture. And they're using some chemical to strip and refinish old furniture. And the case will be that the patient gets some type of angina or chest pain or stroke-like symptom while he's doing this. And then when he goes back to the basement after he recovers from his heart attack or stroke, the chest pain or stroke-like symptom will appear again. And you'll have to remember that methylene chloride is a chemical in these strippers and varnishes, and that can be metabolized by the body into carbon monoxide. The carbon monoxide then is replacing or displacing the normal oxygen bound to the hemoglobin, and there's less oxygen delivered to the tissues. So susceptible tissues are damaged. The patient experiences chest pain or has a stroke. So remember methylene chloride causing carbon monoxide as well. All right, now carbon monoxide poisoning is a very effective way to kill yourself. Turning on the ignition of the car in the garage, with the door down in the garage, this works more times than not because the carbon monoxide binds tightly to the hemoglobin molecule, and oxygen therefore is not deposited to the tissues. Okay, these are always very serious suicide attempts. Carbon monoxide poisoning can cause dyspnea, right? But they're not going to be coughing up anything unless the CO poisoning was from a house fire, from type of smoke. First, they have headache, and then they have confusion, nausea, vomiting. At more severe poisonings, of course, the patient has coma followed by death. On the cardiovascular side, chest pain is very common, and since the heart is hypoxic, arrhythmia, hypotension, loss of cardiac output, hypotension, and death are very common with CO poisoning. So you'll also see these cases, you know, they'll say someone was cooking inside their tent, cooked with a fire, and cooking inside of a tent is a classic way to get carbon monoxide poisoning, or the faulty furnace. The carbon monoxide level roughly correlates with symptoms, but not always. So there's a rough association. You can have a carbon monoxide level of up to 10% if you live in the big city and are a smoker, exposed to a lot of exhaust from cars and smoke. all right? Carbon monoxide level of 20 to 30%, this is causing symptoms. This is giving you the headache and the vomiting and the confusion. Once you get to 30%, 40%, you're starting to see seizures. People have some hardening of the arteries. They're starting to get chest pain. And levels 50 to 70, this is commonly fatal. So what's the treatment for carbon monoxide poisoning? Number one, remove the patient from the source of the carbon monoxide. Seems simple enough. Number two, give 100% oxygen by non-rebreather mask. Now, you don't need to intubate these patients unless they have other indications for intubation, but they all do need a oxygen mask with a non-rebreather bag hooked up to the wall source of oxygen. And the reason why we want to give oxygen is we're trying to force the carbon monoxide molecules off of the hemoglobin and replace them with the normal oxygen. On room air, the half-life of carbon monoxide is 5 or 6 hours. Way too long. On 100% oxygen, the half-life is down to approximately an hour. That's better. If you give 100% oxygen under nearly 3 atmospheres of pressure, then the half-life of the carbon monoxide is down to 20 minutes. So if you consider that your tissues are ischemic for all this time, that you're not getting enough oxygen, you want to get as much oxygen into the patient as soon as possible. So certainly there are people that are exhibiting signs of chest pain, confusion, seizure, stroke-like symptoms, anyone that's been unconscious at the scene. You want to get the carbon monoxide away as quick as possible to minimize the length of time the patient's ischemic. And those are the cases you call the hyperbaric oxygen chamber in your city to see if they'll accept the patient. If you're planning on doing hyperbaric oxygen, you still give the patient 100% oxygen by mask while you are waiting for the hyperbaric to be available. You do not delay treatment. Okay? Is there an absolute carbon monoxide level to send the patient to hyperbaric or not? This depends from city to city, from hyperbaric chamber to hyperbaric chamber. Generally speaking, if the level's under 25, the hyperbaric chamber isn't going to accept the patient unless, of course, the patient's had some crushing chest pain, loss of consciousness, or stroke-like symptom. There's one other case where the hyperbaric chamber will accept the patient with a very low carbon monoxide levels. Can you think what it is? Okay, let's try this case. A woman is pregnant, and she's 6 months pregnant, okay, and she's exposed to carbon monoxide. Her only symptoms is nauseated and maybe she vomited once. She tells you that she feels like she had some morning sickness again, that's all. There was very little headache. There was no shortness of breath, no chest pain, no syncope, nothing else, no signs of end organ damage, but her carbon monoxide level was 15. What should you do? Only 15. But this is a big deal because the fetal hemoglobin binds the carbon monoxide much more tightly than adult hemoglobin. So the fetus is being deprived of oxygen with even mild carbon monoxide intoxications for the mother. So this is a big emergency, even though the mother looks fine. Give her the 100% oxygen, talk to your hyperbaric chamber. Now, it's hard to tell the color. You remember that carbon monoxide patients do not look cyanotic, right? The CO hemoglobin is red. It's the same color as oxygen. So these people could be dead, but they're still pink. Okay? You have to ask to measure the carbon monoxide level directly from a blood sample. And that's the best way to make the diagnosis. Okay? The pulse oximetry level will look normal since carbon monoxide hemoglobin is the same color as oxygen hemoglobin. Okay? All right. If you want to really see how hypoxic they are, you need to measure the O2 saturation directly on the blood gas, not a calculated O2 sat. Okay. Give them 100. You're going to give them 100% anyway, oxygen, and you're going to get the carbon monoxide level. That's how you treat. All right. Let's check this case. The really bad shift at the hospital. 2,500 people present with smoke inhalation from an attack on an office building. The Sears Tower is one of the taller buildings in Chicago. The case is a 68-year-old man with aortic stenosis, hypertension, diabetes. He had to walk down 50 flights of stairs. You have 2,500 people with possible carbon monoxide intoxication. Resources are very stretched, right? Everyone's getting oxygen, but there's not a lot of other time to do a lot of other things. What test do you want to get on this man? Well, if he's having a stroke-like symptom, he's going to tell us with weakness in one hand or confusion. I would want an EKG on him right away, as soon as possible, to see if he has any ischemia. All right, that's the end of carbon monoxide.